Welcome to Novice Cataract Skills presented by myself, Barton Blackerby. In these videos I show you some tips that will improve your cataract skills as well as identifying correct mistakes that a novice cataract surgeon such as myself will make. Today we'll be focusing on wound neutrality. So the first thing you can do to maintain wound neutrality is to utilize your second instrument to hold the eye in position, such as using a CTA when making your paracentesis or a Thornton ring when creating your main wound. Notice that I'm not putting enough pressure with my Thornton ring, which allows the eye to roll away from my incision. Once I correct this, the main wound easily is created. Another thing that you can do is to pivot at the wound. By pivoting at the main wound, you can maintain a nice red reflex which will allow you to visualize your capsulorhexis. A second benefit is that the eye will remain centered and your capsulorhexis will be centered around the visual axis. One of the hardest things to do is to not put posterior pressure on your wound when phacoing. Posterior pressure on your wound will distort the cornea, which will obscure your view of the lens and make grooving and cracking much more difficult. When rotating the lens, rotate, don't push. Pushing the lens can lead to distortion from the cornea, damage to zonular fibers, and increase your chance of puncturing the bag with your second instrument. Rotating the lens also ensures that your grooves remain centered. Notice here that the continued pushing that I exert on the lens will result in an off-centered location of my grooves. This will create irregular sized quadrants which will be much more difficult to remove later on. Finally, make sure that you rotate and pivot at the wound similar to an oar. By doing so throughout the case, you will ensure a good view of the lens and the red reflex. This will also minimize fluctuations of the intraocular pressure caused by burping your incisions. So remember, wound neutrality. Don't get mad, get neutral. Thanks for watching. I hope that some of these tips presented here help you, or at least help you identify solutions for problems you may be having during your early cataract career.